Welcome to Black Health Matters. I'm Daryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Talked about how she's managed to be 99 and still well. One of the most important things she does is that she doesn't eat any meat, and she doesn't drink alcohol and doesn't eat sugar. Sounded like Daryl Armstead. But she said that's the key to how she got to be 100. And it's a nice article. You might read Tuesday's section because she gives a dozen hints as to how to live to be 100. Of course, that is only how she got to live to be 100. You know, there are other people who live to be 100 who did just the opposite of what she's done and lived to be 100. But anyway, it's an interesting article on that. Also, we talked about platelet-rich plasma injections many months ago, but they're still talking about it being something that may be an alternative to knee surgery. And they also talked about how common falls are. As you know, accidents, falls, and cancer are the leading cause of death in people who are older. And they quantified that there were 36 million falls each year. And of course, that's seniors' biggest enemy. And so the things you can do to increase your muscle strength so you don't fall becomes an issue. And of course, when you do fall, then breaking bones becomes easy because some of us are vitamin D deficient and have osteoporosis. So it's something that we all have to work on. But I thought it was interesting to have those articles on how to live to be old and what are some of the things that she did. I'll read you some of them just for fun. The last one is avoid meat, tea, coffee, cocoa, white bread, white sugar, pastry, vinegar, table salt, and alcohol.
Wow.
She says, don't rush to get up in the morning. Stretch and be quiet for a few minutes. A hasty start is a shock to the nerves. Do your exercises before you dress. She talks about the exercises she does. Listen, start the day without breakfast. Morning's the best time for physical activity. Go for a walk, and then go for a swim. She's like you, Buchanan. And it says, don't indulge in violent exercise immediately after eating. Don't go to bed for at least 2 hours after. Yeah. Anyway, those are some of the things that have helped her live to be 99 and to be in good shape. She said, I have all my marbles. I do everything the same. I can work all day and get lots of things done, and I'm happy. So that's one perspective, and how one person lived to be 100. As you know, we've talked about people who lived to be 100 who did things just the complete opposite of what she did. There's another article about hearing aids and how people are worried about looking old. They wear hearing aids, and therefore they don't hear what people say like they should.
What you say, Doc?
Yeah. Yeah, I know that. That's what my kids say to me. Okay, I guess we can start. We got a lot of ones to do, huh, Joe?
While we get that together, Dolores Sanders said she's got to take her mom to physical therapy, so she won't be on today.
Oh,
Daryl
okay.
has to go to the store and buy a snowblower, and he'll be back.
Oh, okay. All right. Well, this is one of the easiest way to help people donate blood and help save a life. One of the issues is everybody can't donate blood. Of course, we have one of the heroes of all time in John Buchanan, but many others, because of their illnesses, cannot donate blood. But this is one of the transplants that's easy to do if you can do it, and saves lives every day. And
Yeah,
sometimes,
I just thought I would put in a couple of ads for blood donation because that's a big part of the reason that I'm here. It's because I heard you do a lecture at the NIH about blood donation. Not blood donation, but organ donation. Blood is tissue, but anyway,
right.
organ and tissue donation. And I was inspired. And you had this beautiful young lady who had done she had the what do you call it? The bone marrow.
Yeah, bone marrow.
Transplant. And I said, well, shoot, if she could do it, I could do it. So that's when I started. And I did my 95th donation on Monday.
Wow, you're getting up there, huh?
Yeah.
5 more to go.
Right.
Then you get on the horse.
John Buchanan,
Yes,
if
ma'am.
Dr. Callender didn't have that beautiful young woman, would you still have done this?
No. Honestly, I would have been scared because I hate needles, and the blood donation needle is kind of big, compared to all the vaccinations and all that. It's a big thing, but I do it every 2 months.
So you didn't let that woman beat you out, huh? If she could do it, you could do it. And she was beautiful too. Okay, yeah. I got you.
Do you remember who that was, Doc?
Yeah. Huh?
Do you remember who that was? Who the young lady was?
I haven't seen her in so long. She was. I haven't seen her about 10 years. So I have no idea where she is. But the need for African Americans is acute. So the first African American to make 100 whole blood donations, Rosalie Powell, huh? You'll be there shortly. Well, what do they have, a Hall of Fame there for people who make 100 whole blood donations?
Yeah, they do. They have a ceremony, and
oh, really?
Yeah, they have this wall visual display, and when you come in, all the 100 donors pop up. So I want to be one of those.
Is that a large group?
I don't know, but I think it is. I think there's got to be 100 or more.
Wow.
Over the years.
Very large.
It's been open. They've had that for many years, like probably 30 or 40 years of blood.
That's what I'm saying. So 100 is small.
Oh.
If only 100 people are in that group, that's. But I mean, that's a lot of blood. Wow.
Yeah, I found out that I have like 1.5 gallons, 1.6 gallons of blood in my body now, and I've donated over 11 gallons so far.
Wow. Congratulations. That's wonderful.
Thank you very much.
Now, this is something that if you work in the hospital, you have to get the shots or have antibody tests that demonstrate you have antibodies. But there are a lot of people who haven't been vaccinated against vitamin B. I'm sorry, hepatitis B, that is. And
Dr. Callender, what is hepatitis?
Inflammation of the liver.
Which is what David had as a very young child.
Well, he had a different type of hepatitis, though. He had autoimmune type of hepatitis.
Hmm.
That was related to the ulcerative colitis, which is
Right.
actually very
Yeah.
different. Yeah.
Yeah. He often spoke of it as a child. He was always sickly, he said, at a very, very young age. And he said he lived at Children's Hospital. And he would go in, it'd be snow on the ground, cold in winter. When he come out, it's 100 degrees where he's been in there for a couple of months. And I
Really?
guess at some point, later, early childhood, it just lay dormant until what, 20, 30 years later or more things
Mm.
started happening again.
Yeah.
But he said it was something he was born with.
Yeah. Yeah. His is very different. There are a lot of types of hepatitis, but that this one is one that you can vaccinate against. And we talk about things being mandatory, but this is probably only mandatory for people who work in the hospital. And if you're going abroad, you may be required to have it. But,
Doc, is the Hep B that's part of the regular uh, vaccinations that you get, you know,
that you should get, yeah.
you should get. Okay.
But a lot of people don't think about it, and so they don't get it, and it's important because it causes hepatitis, which kills people. So this is an article I thought you might be interested in because people always talk about zinc helping effective against colds, and this is the data on this. Trials included more than 5,000 adults, and people were given oral or intranasal zinc. And the data demonstrates that there was a lower risk of developing symptoms consistent with the virus. The data is suggestive that it does make a difference. However, while the data is impressive, when people were given the virus, they weren't. The data wasn't as convincing. But it does support those people who take zinc for colds because the data is, some of the data is suggestive. And if you take zinc,
Nope.
no, nobody.
Part of my multivitamin, I take one a day. It might be a little bit in there.
Okay.
I have a nasal spray.
With zinc?
I'm going to check and see if it has zinc in it.
Mm.
But it's for allergies in the nose.
Oh, okay. All right. The data is suggestive. That's what I would say. It's suggestive. Not conclusive, but suggestive. And it doesn't, there's no demonstration that zinc hurts anything. So
It seems counterintuitive, Doc, because zinc is a heavy metal, right?
yeah.
But anyway,
It said that zinc caused loss of smell in some people.
Yeah, that's what it says. Yeah.
There's probably a few people experience that. That's the
Yeah.
thing about tests. You can do it on a group of 35,000 people, and you come up with different side effects depending on who the person is.
So true. Okay. Now this is interesting that they're going to enforce the vaccine mandate starting January. Uh, that's interesting because uh, that hasn't been done. At least a federal intervention hasn't been done in quite a while. I don't know if it's ever been done, as a matter of fact. But it's seems like it's something that may make a difference in terms of getting people to take the vaccines. %70 are now fully vaccinated. I think 190 million people are now vaccinated, but we have a population of about 350 million. So we still got a ways to go. Yeah. Now the ability to impose the vaccine is going to be how the federal government is going to do that is remains to be seen. And who knows, maybe by January, we'll have so many people vaccinated, they won't have to do that. I hope. Now this is kind of scary. How many employees have the hospital lost to vaccine mandates, and it's been significant, and it has led to staffing shortages, and it's every hospital has been affected by it to some extent, and there's so many different reasons that people give for not wanting to take the vaccine, many of which are unreasonable. Some are valid, those people who have religious restrictions, but many are not. They just have reasons which seem not to add up. Look at these numbers. Albany suspended 204, which seems like a small number. Advocate Oral Health has terminated 440. It's less than 1%. So that in most of these cases, is less than 1% of the people. But so small numbers, but significant numbers. Seems like 1% or so, which is surprising. I thought it'd be more than that, but anyway. And it goes through, and it's interesting that people have had medical and religious reasons for not doing it, but they are in the minority.
Dr. Callender, what do
Yes.
hospitals say when their employees who have already been vaccinated with everything else refuse this one vaccination? There's no logic to it. All of a sudden they got religion, or all of a sudden they got fear. There's no way they could be even logical by saying, I'm not going to get this one, but I got all the others to work in the hospital.
They're terminated.
There, okay.
Yeah. And it's just pretty universal that, but it's interesting that the number is only about 1%. I thought it'd be higher. But you know, small numbers can be outspoken. So, but any thoughts about the people refusing to be vaccinated? Were you surprised that the number's so small, or did you think it would be higher? What are your thoughts about it?
I think that the news media has blown it way out of proportion, I think. But, you know, several places like Chicago and Montgomery County, there is significant impact. There is significant impact on the school system, because a lot of some teachers are not teaching, and that puts a real burden on the other teachers. A lot of police officers are not getting vaccinated, and it's a ripple effect. You know, that's what I see.
Okay, this is an article on why exercise. And I thought it was good, although we start off talking about a lady who's 100 who exercises every day. And some people still don't like to exercise. I have a niece who doesn't like to exercise. But my perspective, if you want to live quality life, you need to exercise. But look at that, 3 of 5 U.S. adults do not perform any muscle strengthening exercises, which means resistance, weightlifting, and those kind of things. And those are the things that keep you from having accidents and falling and hurting yourself. So weight resistance training and that kind of weight bearing, weightlifting exercise has become an important part of exercise. And some would argue that if all you do is aerobic exercise and don't do any weightlifting, that you're not completely doing what you need to be. Exercise, part of it has to do with muscle strength. And that's where the resistance comes in. And then only 8% of adults age 75 or older perform resistance training exercise, which says that that's something that we need to do more of. How many of you do weightlifting? Remember in our support group that he came and told us to get 1 and 5 pound weights to use them to help in the exercise and the weightlifting. It doesn't have to be large amounts of weight, but weightlifting and resistance training exercises is especially important in the elderly.
I do push-ups, so that's weightlifting.
Yes, yeah. That's resistance, right.
Dr. Callender, maybe people that are in childcare that are over 60 or babysitting their grandchildren and lifting up those babies, that's weightlifting.
Well, no comment.
They say we stay younger the more we are around children, and you got to lift them up and everything. So that's why they keep you so young, because you always picking them up.
Okay. Well, an organized system of resistance training becomes important, and doing it regularly is critical. It's interesting that it's supposed to positively affect your cognitive function as well. So it's something that we need to make a habit of.
Dr. Callender, what is atrophy?
Atrophy means that the muscles weaken and become weak. Atrophy means that whatever strength you have is decreased. So when you have atrophy of muscles, that means the muscles weaken and cannot support you. So atrophy means that the decrease in the number and volume of whatever you have. That's an interesting version of the older you are, the more antibodies you have. And they compared the non-hospitalized COVID positive Canadian people, and they tested them, and everybody who had infected produced antibodies, but older people produce more antibodies than the people under 50, which is interesting, because we're saying just the opposite. We're saying that when you get over 60, you don't have as much immune activity, and therefore you need a double dose of most things. But this is a study. This study demonstrates that that was not the case, which is very interesting. That's why it's important that everybody does research, because sometimes you have different results. So we'll have to see what this means.
Yeah, it's ignorant because that means all of us should move to Canada.
No, it means that people in Canada like that. I mean, who wants to move to Canada? that's that's one of the coldest places in the world. Yeah,
Yeah, well, maybe that's the
I
reason.
remember I went there in July and it was snowing. Yeah. So, but the point you bring up is it different in other countries? Is that just a phenomenon that is associated with Canada? I don't know. But this study was done in Canada, and that's why when you have studies, you have to identify where the study is done, what kind of population is it? Is it having a significant segment of people of our ethnicity or not? And so those are questions that this study doesn't answer.
I
But it's
have a
going to
question,
be, yeah.
Dr. Callender. So the human immune system is so fantastic. We've talked about this a number of times. Being able to recognize over 3 trillion different surface structures and create a response to them to protect the body. But there aren't there like that. That means there are a ton of different antibodies. So it's weird that they would say that antibodies in general are produced more by older people.
Well, actually, they were talking about antibodies for COVID.
Oh, okay.
They're talking about antibodies for COVID specifically. That's what
Oh,
made this study different.
okay. Well, I'm not gonna move to Canada.
Okie dokie.
This Paul and Fauci uh, battle is ongoing. I mean, one week Fauci is speaking, next week Paul is speaking, and they're both saying different things. Paul is an ophthalmologist, so he's a doctor as well. And so he and Fauci at it all the time. And that issue of funding Chinese research to me is a fake issue anyway. To me, so what? I mean, NIH funds studies all over the world, and so it funds Chinese research. All right.
Dr. Callender, there's a ton of Chinese scientists and researchers at the NIH right here in Bethesda. A ton.
Absolutely. Yeah. And so it should be. There should be research from all over the world, and they are. And I'm not sure why he continues to make a big deal about it. Paul does.
He's a racist.
I don't know why, but he's anytime Fauci says something, he comes back with this issue of the origin of the COVID virus, which we do not know. And but that battle is ongoing. Just the week after this, Paul was on TV again talking about the origin of the virus. Here's the problem: we don't really have any absolute data that identifies exactly what happened. We have a lot of theories and talk, but we don't have any absolute knowledge. And the Francis Collins made a comment about this just a month ago, that we don't really know, and that most of it is conjecture. And I guess this will go on and on and on and on. I don't know what difference it makes, but those two are battling over that, and I think what should be done is that we need to get over the virus and take advantage of the fact that we now have medications, vaccine, and we now have medications that treat COVID. And this is really what we need to have. I don't know why Paul wants Fauci to take responsibility for the pandemic. Why should
he wants to blame him for it.
Yeah, the blame game. But why the blame game? I mean, that's, I think the blame game is one of the ways to restrict knowledge, not to enhance knowledge. I think we need to be more engaged in finding the treatment and the way to prevent and treat this virus the same way we did with the flu. And I think that's what has been done. And this is another answer to this. The Pfizer says their pill, like Merck's, cuts the risk of severe COVID, but it does so by 89%, which is incredible. And when you look at what's happened over the last 2 years, it is incredible, because what we have now is we have the same thing that we had for the flu. We have a vaccine to prevent the flu. We have a medication to treat the flu. Now we've got a vaccine to prevent COVID, and now we've got a treatment to cure COVID. So I think that we've come a long way, and we're almost there. We're not there yet, because these drugs have not been FDA approved. But if they are FDA approved, we will have gone full cycle.
So, Doc, the course is you have to be sick first, and then you take this pill, and it keeps you from dying after you.
That's correct. Right.
After you get tested positive, and
That's
go to
right.
keep you from dying.
The vaccine is to prevent it. This medication is to treat it if you get it.
Okay. Right. Okay, that's the difference.
Yeah, and that's means we're going full cycle. So now we're at the stage now. We're in 2022. We should be able to knock out. When you think about 750,000 people died from COVID over the last 2 years in the United States, and 5 million in the globe. So we would be able to significantly impact the deaths from COVID-19. Now I guess we have some more slides to talk about the tremendous drop in longevity that has occurred as a consequence of COVID. $900,000 kids got virus shots, and this is, of course, something that is a long time coming, but final clearance occurred, and now kids are getting the vaccine. So this is good for grandparents because they don't have to be afraid of their kids giving them the virus.
And teachers, big time.
And teachers, that's right. Yeah, teachers. Yeah. So this is great news.
I tried to find an article. I'm sorry, Doc. I tried to find an article in Loudoun County. This one provider gave the wrong medication, gave the wrong vaccination to children. It was a watered down version of Pfizer, I think. And, a lot of parents are now they're outraged that this one company, they gave over 100 vaccinations of the wrong dosage. So they're not sure whether it'll have a negative effect, but the company was closed down, shut down, so they can't do any more donations, vaccinations. I'm sorry.
Yeah, it's too bad. Yeah. This is what we talked about. The life expectancy has fallen sharply because we've had so many deaths. When you think about it, the last flu epidemic killed 600,000 Americans. This one has killed already 750,000 Americans. So it's killed more Americans than any other viral infection in the history of America. So life expectancy fell from 76.7 to 74.4. Women who live longer than us fell all the way down to 80. And what is really scary is so many relatively younger people dying from COVID, even now. So, of course, and they mentioned this, but homicides and drug overdose also had sharp rises. More people are killing each other, and so
Plus the suicide.
right. Yeah, it's kind of horrifying to see all of this data: the drug overdose, homicide, suicide, anxiety, depression.
The nice thing about the life expectancy tables, it's based on if you're born today, and if you're a man, you'll live to 74. But then the tables are also based on your current age. And so if you're currently 72, the tables say that you'll probably live to 79. So the longer you live, the further out you could get with the life expectancy tables.
So there is the answer to depression, because I'm 74.
I'm not understanding what you said, John.
Oh, I just said I'm 74. So
Yeah, but you weren't born today.
Mhm.
If you're born today, it says that you'll probably live to 74. But since you're already 74, you got more time on the clock.
Yeah. Now, how much
Right.
more time do I have?
Only God knows the answer to that. Although if you listen to your brother-in-law and follow his mandate, you live to be 90.
Hello, young lady. Good morning.
Well, this is interesting to show that those people who trust media more likely to believe the misinformation about COVID, which is interesting. It's something that Darrell has commented on for quite a while about who is leading the freedom for medical choice is what they call it now. And it's interesting how they phrase it now. Freedom for medical choice. So
It's sort of like freedom to die, right?
yeah.
You cannot make me get vaccinated, so I can die if I want to.
Yeah, that's about it. Yeah. Well, it's interesting to see that politics impacts everything. That's kind of sad to see that. Well, it's interesting how the social media has impacted all of this, and how the political issue, whether you're Democrat or Republican, have made a difference about what you call the right to die from COVID.
Do you remember this, Doc, about the microchip?
Yes. Mm-hmm. Yeah, I remember that statement. They have all kinds of crazy statements on the media. Yeah, and then hydroxychloroquine and ivermectin. That's a sad commentary. Look at this data. Republicans, 40% wouldn't get the vaccine versus 9% of Democrats who said the same. It's tragic that politics would be that way, you know. The right to die, as you said, Buchanan. And so many people are dying. It's painful. So many people in the prime of life too. This is an article that talks about the protection against COVID infection, which has been great actually. But what they talked about declining effectiveness, their declining effectiveness has never been as low as the protection that we get from the flu. So, so the declining is significant, but it's still very high. And I think this was the basis for the booster shot. But it's also interesting that we're talking about a decline of about in 6 months, whereas with the flu, the protective aspect of the vaccine was more like 3 months. So it's interesting that the RNA virus seems to be a longer duration of effectiveness than the flu virus, the flu vaccine.
Okay. Okay.
Well, I think that it's important. All this is important to understand why a booster shot might be important, why it may help avoid the breakthrough infections that have occurred. Now, this is an article about the people who are immunocompromised, who are greatest risk for infection, HIV, cancer patients, as well as transplant patients. And talks about how doctors need to be more knowledgeable about that population and be better able to help the needs of those patients be served. And I think universal contact precautions become important. And when you say universal, that just means that you have protective gear on all the time, and you act as though you could get the infection from any person, which means you practice hand hygiene, social isolation, and you wear protective equipment to keep you from getting infected. And that's one of the reasons why, remember we talked about the patients who wanted to get a kidney or liver transplant, but the center would not transplant them because unless they had been vaccinated, because the immunocompromised patients had a much higher death rate from COVID, approximating 50%. And so it was felt, therefore, that if you did not get vaccinated, you should not be transplanted. And some centers follow that practice and some centers don't. Any thoughts about the ethical aspects of that? Because some people initially thought it was unethical. And based upon the data, it's actually a medical issue for many, and some it's not.
What is aspergillosis?
a fungal infection that occurs in patients who are immunosuppressed, especially patients who transplant patients, HIV or transplant patients, HIV patients, some cancer patients, some diseases like multiple myeloma and such. They have more common infections, but also more fungal and parasitic infections. Aspergillosis is one of the commoner fungal infections.
Dr. Callender, for those people who are immunosuppressed, well, actually, the question I have is transplants. Some centers you say will not transplant a patient unless they get the shots. Well, how does testing positive and testing negative play into a person getting a transplant?
No, it's not a matter of whether you test positive or negative. It's a matter of whether you have been vaccinated. The issue is if you're vaccinated, then they will transplant you. If you're not vaccinated, they won't transplant you.
Even if
So
you're
it's not, there's no, it has, yeah, whether you're negative or not.
right. Okay.
If you're not vaccinated, they won't transplant you. And they had a case where this lady was waiting for a transplant and she had medical reasons for not being vaccinated. And in spite of that, they wouldn't transplant her. And so the question was, is that ethical or not? And many felt that the evidence, medical evidence, indicated there was a medical reason. Yes, John, what was your question?
Dr. Callender, does anybody know if Colin Powell had his booster shot or how many shots he had? Because him being immunocompromised, he should have had the booster, or maybe even four shots.
Well, I don't know. I think it is clear though that with multiple myeloma, it's unclear whether the booster shot would have made any difference, and I don't know whether he had a booster or not. Although they did say he was fully vaccinated.
That's what I
What
heard.
does that mean? What does that mean? I don't know.
They were referring to COVID-19. He was fully vaccinated. I read the article.
But
yeah,
that means two shots, right?
But we don't know whether that means 2 shots, 3 shots, or 4 shots. That's what he was asking.
Yeah.
He was asking whether he had 3 or 4, and I don't know the answer to that.
Yeah, he probably.
They just said fully vaccinated.
Yeah, they meant 3.
Right. Well, and then there's evidence, as we saw last week, that for some people, they may need 4. And with multiple myeloma, which is a disease which is characteristic with agammaglobulinemia, it's likely that you need the most you can get and still may result with the outcome that he had. Any other questions about that?
The only question I have is that, as you said, different centers have different regulations. So, is there any effort to standardize what these clinics are doing?
I think that what is lacking is data, and I think as they have more studies, they have more data, then they'll be able to have a firm position. Right now, there isn't a lot of data to answer that question. There are few transplant centers that have done the studies, but we can't generalize, and that's the problem. And I think when you have more data, probably in another 6 months, maybe you may be in a better position right now, and that way you can then have a UNOS or the transplant centers have a unified position on what should be done. Right now, there isn't a unified position. Now, this is an interesting issue about the doses of the vaccine and why the dose is less for the children than it is for the adults. And this is an article that talks about how the immune system is very, very immature at birth and dependent upon the mother's antibodies. And as they get older, they become more adaptive. And they then develop their own antibodies as contrasted with the antibodies your mother produces. And so as you get older, your immune system builds up. But at the age of 5 to 11, your immune system is not as mature as it is later on. But the dose that is required to activate your immune system is not as high as it is for the older patients.
Dr. Callender, it sounds like the immune system is like a bell-shaped curve. At the left end, you have the children who are building up their immune system to the point where it's very strong, and then as they age, you slide down the right side of the bell-shaped curve, and your immune system begins to weaken because of age, except for if you live in Canada.
Well, I remember that was only about COVID, but yeah, I think that you gave a good description of how it is. Yeah, that makes sense. And this article pretty much says what you just said about the immune system. Yeah. That's an interesting article. I don't know what it means in the long run. You know, when you go to court, one court overturns it until you go to a higher court. So I've never quite understood the court system and how, for example, they sought $9 billion from Johnson because of the drug opioid crisis. And I'm not sure I've understood why they expect to get 9 billion from them. But anyway, the total is more than that because the immense problem with the opioid crisis, which is still accelerating, is interesting. And who's to blame? And that's what this is all about. And of course, it's all about the obscene profits that they made as a consequence of the opioids. So, can you imagine a $26 billion settlement proposal? Wow. That gives you an idea about how much money they made off this stuff. Yeah. Any thoughts on that? You got any thoughts on this?
Yeah, it seems like sort of like the NRA, or the gun manufacturers. Why don't they sue the gun manufacturers for all the deaths?
It's politics. They pay too much money to the Republican Party. That's why. But your question is a good one. It's the same thing. It's equally applicable because the guns are killing people and opioids are killing people, and the incidence of deaths continues to rise.
My guess is that the doctors that prescribe opioid for pain management are a very small part of the problem. The biggest problem is the dope dealers out on the street corner who hook these the drug addicts with that opioid. As soon as they get it, they have to get more. They have to get more.
Well, I think you're absolutely correct. However, that's not the way they look at it. But I agree with you that the doctors are about 1 to 5% of the problem. But time will tell because, but what is happening, which is problematic to me, is they're making it so difficult for people who have pain problems to get their medication. And that to me is the downside of all of this. Now they have so many obstacles to giving people pain medication. And there are people who have sickle cell disease, and people who have cancers, there are people who have legitimate reasons to get pain medicine. They can't even get pain medicine. And so I think we need to reassess this. But somebody said it's the doctors, so they then put all the blame on the doctors. When in point of fact, I think that it's a lot of people. Doctors are just one of the people that are. This I thought was interesting because Aaron Rodgers said he was immunized. He didn't say he was vaccinated.
Right.
He said he was immunized. And so they treated him like he was vaccinated. And that was a mistake. But he didn't lie about it. He said he had a different process of immunization, but he wasn't vaccinated. But he never wore a mask or any of those other things. Mm-hmm. And that's why they're fining them. But the fine is kind of a joke for a guy who's making all the money he's making. Mm-hmm.
Dr. Callender, how do you define immunization versus vaccination?
No, vaccination is a process in which you receive injections by standard that gives you immunity. What Rogers had and what he called, he didn't say he was vaccinated, he said he was immunized. I don't know what that means because I don't know what kind of treatment he got and I don't know what he was immunized against. So the real question is, you are immunized against what? Okay, and by what? And I don't think anybody asked him those questions.
Right, and I think the powers that be in the football arena, they knew that, but he's a key player. They wanted him to play and they accepted his term immunized. If it was some low-level football player, that wouldn't have stood. No, you have to be vaccinated. So I'm sure they realized the difference.
Well, I think he should have been treated like anybody else who was not vaccinated. And to your point, he was not. And that's why they sued him, because and wherever they saw him, he never had a mask on.
He took ivermectin, the horse dewormer.
Is that what he had?
Yeah.
And that is not known to be an effective way of protecting somebody against COVID-19.
That's really sick. That's sick. Sorry about that.
Yeah, the question is, yeah. Wow, this is that's sad. That's sad, isn't it? That he refused to get the vaccine and died from COVID. Oh, wow. Well, it's an isolated case, but it's a sad case. But there are many cases just like this. It's just that you never hear about. You know, this is interesting because you never know whether Aaron Rodgers' positivity affected anybody, because it didn't bother him. but you never know.
So he tested positive. That means he could spread it to anybody that he came
Yes,
into
he could have.
contact.
Yes, that's right. Rogers could spread it to anybody.
So this guy on the Vikings, same thing.
Yeah, but except he could have. He was in contact with Aaron Rodgers as well. And so it's kind of sad.
I can just see a lawsuit. I'd be suing Aaron Rodgers.
Yeah. Oh, we hope he gets well.
Dr. Callender, have the suits in court started about COVID-19?
Say again?
Have they started lawsuits on a big scale related to this vaccine and being taking the shots or not taking the shots? Have there been any major lawsuits yet?
Yeah, and they've all lost, but I think the most of them are yet to come. But so far, the early ones have been, the courts have found against the people, and most of them have been people who fought against being terminated. But those are the only ones that I know of,
Mm-hmm.
and they've lost those so far.
Here's the flip side of the coin. Kirk Cousins, he used to be the Redskins quarterback. You know, he refuses to get
unvaccinated.
vaccinated.
Yeah, and he makes plenty of money too. Yeah.
So what's the difference, Doc?
Now they have rules for unvaccinated. In other words, there's a special protocol for unvaccinated players, and they have to follow those rules.
To get tested every day. Right.
Getting tested and all that stuff. So it said the Vikings had the lowest vaccination rate in NFL, which is sad. And as teachers, I thought it'd be good to know about what parents should know about the COVID vaccine for 5 to 11-year-old, because these kids are going to school. So they can get it at their doctors, their pharmacies, and yeah. $2 million 5-year gotten sick from COVID, and only 95 have died. Well, you want none to have died, actually, but anyway, 94 is a small percentage.
Is that 2 million number worldwide or US?
I think that's I think it's US. Yeah, I think it's US. The myocarditis is the one thing that is still problematical, and we still don't know. And people have died from myocarditis. We know that does occur in children.
Go back up for a minute, John. Okay, right there. Obesity, diabetes. Okay. Thank you.
Yeah, so it says CDC, so it must be just US. 2 million.
Yeah, yeah. Side effects are pretty much the same, except the myocarditis issue and pericarditis. And I think this statement addresses the fact the risk of go down a little bit. Yeah, this statement about the risk of myocarditis. Keep going down, past it. Keep going.
Going down?
I'll go back up. I was trying to. The risk of myocarditis from COVID is higher than the risk of vaccination myocarditis, which is why they continue to give the vaccine.
Okay, that makes sense.
Because it still is a complication that can be lethal. Counting on herd immunity does not seem a good way to go, but I like his answer. What can I do to protect my children who are too young to be vaccinated? Get everybody else in the hospital vaccinated so they can't give it to them, right?
I have a question for the young children, ages 5 through 11. How long would it take you to notice the complication of the heart issues?
Probably within days to a week.
Okay. And would that be something like shortness of breath or something like that, or?
Usually might be chest pain.
Okay.
By the way, Cheryl, did you get your registration yet?
Yes, I did. I got it
Okay.
yesterday evening.
Okay.
Yes.
All right. Okay. All right. But it's something. Your grandkids are how old?
Well, the younger two now are 2 and 3.
Oh.
Yeah, so they're still not in the group yet, but
Right.
I'm just
Right.
but yeah. And then the older two are fully vaccinated.
Oh, okay. All right.
Mm-hmm.
And how old are they, Cheryl?
The oldest two are 14 and 15.
Okay.
Time flies, boy. Wow.
Yes. Yeah, they're 14 and 15. High school students now.
That's amazing. Wow. Considering that you got your transplant so long ago, 35 years now. Huh?
Yes. Yep.
Yeah.
Yep.
Yeah.
35 years. Yep.
Pearling's on the line. Yeah. How long is your transplant?
Yes. Unmute, Cheryl.
24 years.
24. Okay. All right. And then John is what, 28 years? Liver transplant, say 28 years?
Yeah. The liver, yeah, it'd be almost, it's 8, yeah, you're right, 28 years.
You're welcome.
Well, we're blessed people, you know.
Yes.
Okay. Any other issues? Anybody want to talk about anything else?
This morning in Apple News, I just saw where COVID is spreading to wildlife population. They tested a third of the deer population in Iowa that had active COVID infections. And so the concern is that the COVID can mutate with wildlife and return back to people.
Well, I tell you, interesting, isn't it? Yeah.
Yeah.
Wow.
I got a question. I have bursitis on my left elbow, and I read a little bit about it. I put it on ice for 15 minutes. I think it's an on and off situation. Do you know how long the ice should be on it? How long it should wait till you do another application? 15 minutes.
Well, ice is not really the treatment for bursitis, but it's a symptomatic treatment for pain. But actually, one of the best treatments for bursitis is steroids. Injection of steroids into bursal sac. But have you seen an orthopedic doctor about it?
Yeah, because I had it in my left arm.
And what did he say? He or
They
she
just
said.
took some of the fluid out of it, and that's it.
Did that help?
Yeah, it helped to go down, yeah.
Yeah, because when I had bursitis, I got steroid injection and it went away immediately. never came back, but
Hmm.
that's one of the treatments for bursitis.
Yeah, Dr. Callender, I have arthritis in my hip, and my doctor prescribed meloxicam. There's another name for it. I thought it was a pain reliever, but it's a muscle relaxant.
Mhm.
It it really worked. I mean, I walked 6.8 miles yesterday and no pain at all. And,
Yeah, arthritis is different from bursitis.
oh yeah, I'm aware of that.
Yeah.
Yeah, both bursitis was in my elbow, and the symptoms are, pain in the elbow and swelling around the elbow area.
So they didn't give you any other medication for that? Just ice? Oh, you
No,
said you
that
took
was,
out the fluid. Took out the fluid. How long ago did he take out the fluid?
um, that was on the left elbow. It's been a month and a half now.
Oh, I see. Okay.
Yeah, that was my pain doctor that
So
took
you
care
need to go
of
back
that.
to,
But
yeah.
I haven't seen a doctor about this one because it just came today.
Okay. Oh, okay. All right.
Speaking of cold, a lot of inflammations are the source of a lot of our aches and pains are inflammation, and can be treated with cold therapy, which includes icing or something as simple as taking cold showers. You take a cold shower 4 days a week, greatly reduces your level of aches and pains and inflammations.
Wow.
So when I started my cold showers, it was tough to get up to a minute. Now I stay under a completely cold shower for 6 minutes.
Mm.
Okay.
That cold therapy is also known to reverse aging.
Yeah, okay.
According to Dr. David Sinclair, who's a geneticist at Harvard
Carol, you're
University.
on mute. Carol, you're on mute.
Your sister's on mute. We can't hear you.
Yeah, come on, Carol. Take your mute off and ask your question. There we go.
I know Daryl sent me the article helps you to live longer because it sends your body into shock. And every time your body goes in shock, you live longer. That cold shower sends you into shock. So we're going to live a long time because keep going into shock.
Oh, well, what happens is, your body, the cell reparative processes are triggered by things like hunger, cold therapy. Of course, now sleep helps your cells repair themselves. Just as things as simple as skipping a meal, there's an old saying, it wouldn't hurt you to skip a meal. Well, you don't have to always go hungry, but skip a couple of meals a week and it really helps your system.
So you need to fast and pray at least twice a week.
You'll do a lot of praying under that cold shower.
Always be in the state of prayer.
The importance of meditation. Right.
Speaking of prayer, Doc, I'm going to be performing with Shiloh on the 12th of December. We're doing Messiah. So that's
oh, okay. Finally back again.
That's after 2 years of being shut down.
Yeah.
So they're going to have a live presentation at Shiloh?
Yes.
Oh, okay. And a real live orchestra. Yeah, because you're playing the timpanis. Yeah. Okay.
I'm not sure how large the orchestra is going to be, but we all have to have masks, and I think we have to be immunized as well.
Who's the conductor?
Thomas Tyler.
Okay.
Oh, Tyler, yeah. He's a great guy. Quite a guy. Nothing from Asbury yet, huh?
Nope, not yet.
Okay.
So Asbury is going back in person though, right?
We've been in person since October. Yeah. Is anybody not who wants to register, not registered for the celebration for November 20th? I tried to send out.
I didn't hear about that.
What was that?
What's going, Pearline?
Oh, okay. I'll send you an invite.
Okay.
Anybody else?
I do
Okay.
plan to register.
All right. Okay, well, that takes it for today. Have a great weekend.
Okay.
Enjoy
Okay.
the holiday, Armistice Day. We didn't talk about it. I don't know what it means to. Anyway.
Yeah, National Rifle Association would like that holiday.
Oh, okay. All right. Okay. All right.
Have a great week, everybody.
Right.
Great weekend.
You
Okay,
also. Please
All
stay
right.
safe.
All
And
right.
Darryl, thanks for coming up with the solution to the problem with identifying the speakers. You handle that so quickly and so easily as though it was nothing to it, like you handle most things. Anyway, yeah. Thanks for your invaluable expertise.
Welcome.